Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel today we're going to be talking about meth mouth. Let's start. So I am making this episode, although I'm sitting in India. This is an actual disease that actually affects a lot of Americans and Europeans and Western countries people. Methamphetamine is a drug which is very addictive. It's a highly addictive substance which kind of debilitates people's lives and destroys it as well. Because it is so addictive, it gives a euphoric feeling which lasts for about at least 8 to 12 hours. That's why it is so addictive, and it causes a lot of debilitating problems, right from side effects such as you can have angina pectoris, you can have myocardial infarction, permanent nerve damage, vomiting, diaphoresis, palpitations, angina, and all those things. So, and because of the fact that it's a street drug which is kind of easy to illegally manufacture, it ends up not being titrated, and a lot of people overdose and succumb to it, unfortunately. Now, meth mouth is basically the oral conditions where you see it in a lot of habituated users of methamphetamine, which is also known as crystal meth or ice, or even a lot of names that are there in the market. And you have to understand that there is a very characteristic presentation of the mouth where you can see that there are buccal smooth caries. There is a lot of periodontal breakdown, and in fact chronic users generally end up losing all their teeth, and it becomes a big time quality of life issue. Now, what you need to understand as a clinician, if anyone is watching from the dental background, you need to be very careful while treating these patients. Of course, no elective treatment has to be done. If they are actively using the drug, they need to go into rehab, get their counseling done, and they need to be out of rehab so that they can get their treatments done. And on top of that, because it's an IV drug as well, they carry a risk of transmitting hepatitis B, hepatitis C, and even HIV viruses. So you have to be very careful when you're practicing universal precautions with them, and always get the test preemptively done so that you already have the history if you want to treat them, or whatever way you want to treat them. Now, the classical presentation I've already talked about. It's very simple. Because of the fact that you have buccal smooth caries, there's a lot of teeth that come down. You might require full mouth rehabilitation. The reason for this breakdown of teeth and tooth structure, because the characteristic features that is known as rotting, crumbling teeth, which are blackened from the sides and from the front, is because of the fact that this drug evokes, it's already pretty acidic and it's taken with alcohol or water. It also leads to vomiting like episodes, which can lead to gastroesophageal reflux disease. On top of that, meth users usually crave highly acidic carbonated beverages. They take a lot of sugary substances to get the high and everything, and they're not able to practice oral hygiene because they're high for such a long time. Now, as debilitating and harrowing as it might sound, if someone is out there, probably in the Western countries, in the US, who feels that they have come out of this trap of the drug abuse and now are pretty much sober about these things, but they feel that the dental treatment in the West is actually very expensive. That's why I am creating this video for awareness for people who can get themselves rehabilitated. Mind you, we will not rehabilitate you unless we have all the tests in order, so that we can rule out any risk of transmission of any diseases that could probably be bloodborne. And that's why it is my duty to tell you that we would want you to get tested. And if you want to come to India, you can get yourself tested here, and we can probably get all the tests done. And if everything is fine and we know that you're not an active user, we can help rehabilitate your teeth and your smile. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly, as I might be busy with patients. Just drop me a WhatsApp message on my number with your name, your location, and the common oral health problem that's giving you discomfort, and then we can have a chat. And if you have any queries, doubts, apprehensions, or insights, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.